So this picture over here is again the back of the eye, and this is something called as age-related macular degeneration. Typically, this will happen in patients who are above 65, 70, and it could be hereditary. Again, if you look at the picture, you will see those white cotton kind of spots in the center of the eye. This is a degenerative process, and what happens is it's your retina, your macula is what goes through a degeneration, and again, it's age-related, and it usually happens when you are out too much or because of the exposure to ultraviolet rays. And like I said, it's purely related. And again, this can lead to a lot of bleeding in the back of the eye. And once again, if you have that bleeding in the back and in the central area, your central vision is what's going to get affected. And again, you have to get this treated either by laser or by shots, by medications. And again, it's purely age-related. And if you, the biggest difference that we see between glaucoma and between age-related macular degeneration is that in glaucoma, when the pressure is high, your peripheral vision gets affected. Your side vision gets affected, and it can lead to tunnel vision. But when you get macular degeneration, like what this picture is showing, it's your central vision that gets affected first, and then it goes all the way far out. So they're two opposite things, but it can eventually lead to blindness. So this is something that I wanted to actually focus a little bit. This is called the Amsler's grid. This is something that we typically give out to patients who do have macular degeneration. And it's usually given so that you can detect if you have any loss of vision in the back of the eye, or if you have any black spots in the back of the eye. So it's a very, very simple test. What you have to do is you can actually print this from Google, and you can just type Amsler's grid, and I can tell you what it is exactly. What you have to do is you just have to put this on a wall. When you print the paper, just put it on a wall. You can stand like around 16 inches or 20 inches away from that. You cover one eye, and if you are wearing glasses, you can wear your glasses, your reading glasses for that. So basically you cover one eye. Say if you cover your right eye, you're looking at the black spot with your left eye, and you have a pen in your hand, and if you feel that you're seeing any distortion, if you see any lines that are crooked, or if you see any black spots, with your pen, you just mark those areas, and then you switch it with the other eye. And this should be done, like I would say, on a weekly basis. And so this gives the doctor an idea, and even the patient an idea, you know, that what part of the retina is getting affected because of any degeneration. So I would suggest that everybody should do that like above the age of 60 or 65, and especially if you have been diagnosed with macular degeneration by a doctor, you should take care of this, and you should do that because it will show you that if it's getting worse or if it's stable.